Hello everyone, Dr. Fink here. Today we'll talk about alternative treatment options for low testosterone. Quick disclaimer, this is not medical advice, it's entertainment only. So if you have low testosterone levels and you still wish to found a family in the future, don't worry, there's different options to treat your low testosterone instead of hopping onto testosterone replacement therapy, which will most likely cause infertility in males. All right, so first we have to make the distinction between two types of hypogonadism, which is the medical term for low testosterone levels. There's primary hypogonadism and there's secondary hypogonadism. Primary refers to dysfunctional testes, so where the testosterone is produced, there's an issue there and testosterone cannot be produced at the production site. This is primary hypogonadism. In this case, you most likely need testosterone replacement therapy with the following risk of infertility. However, if you have secondary hypogonadism, where there's a problem in the signaling location in the brain, the hypothalamus pituitary axis, then there's different options to treat your low testosterone while remaining fertile. Okay, so the hypothalamus pituitary axis signals our testes to produce testosterone via the release of two hormones called luteinizing hormone or LH and follicle stimulating hormone or FSH. And LH tells the testes to produce testosterone, FSH tells the testes to produce sperm. In secondary hypogonadism, most likely LH levels and FSH levels are downregulated. So this is a good indicator. If you take your blood test and you have low testosterone, take LH and FSH. If your LH and FSH levels are normal or elevated, it would indicate a problem with the testes, hence primary hypogonadism. However, if your LH and FSH levels are downregulated below average, then it indicates secondary hypogonadism, so a problem in the hypothalamus pituitary axis. And in this case, there's another option that is very, very potent and beneficial for low testosterone patients, which is HCG treatment, standing for human chorionic gonadotropin. And this medication is basically mimicking the effects of LH. Okay, in secondary hypogonadism, LH levels are low, so the signal does not go to the testes to produce enough testosterone. But HCG is doing exactly the same thing. It goes to the testes and tells them produce more testosterone endogenously without injecting or taking testosterone from the outside. Okay, so that's great. So we basically kickstarting, triggering our own production with the aid of HCG. And the beauty of this is testosterone is produced in exact the amount that we need because the testes only produce as much as we need in response to HCG. Okay, and this is different than if we inject testosterone, for example. We can overdo it, we can inject too much testosterone and have side effects from elevated testosterone levels. Okay, and this most unlikely will happen with HCG since our testes will only produce as much testosterone as we need. Okay, so this is very, very beneficial if you have a secondary hypogonadism, and you will probably not shut down your sperm production as with testosterone replacement therapy since you're just kickstarting your own endogenous testosterone production. All right, so HCG, always important to consider this option if you wish to found a family in the future before hopping on the testosterone replacement therapy treatment option, since this might cause infertility in the future. Okay, especially for younger adults who wish to found a family in the future, consider this option. Take your LH and FSH levels, talk to your healthcare professional if you qualify for HCG. This might save you a lot of trouble in the future if you wish to found a family. Okay, only downside of HCG availability and the price tag. 10 years ago, HCG was readily available and pretty affordable. It was like $30 to $50 for a vial of 10,000 IUs. And now, after 2020, 2021, this has been reclassified as a biologic drug, and the restrictions have been the requirements for pharmaceutical companies are much more strict to produce HCG, and hence the availability has gone down and the price tag has gone up. Now, for the same vial of 10,000 IUs, you are looking around a couple $100. Okay, so it might be pricey, a couple $100 per month for HCG therapy. All right. How do you take HCG? Usually 500 to 1,500 IUs 2 to 3 times per week, and injections can be done subcutaneously, so in the belly area, or they can be done intramuscularly in general. That's always good to consult with your healthcare provider. So I hope you enjoyed this video about HCG, and keep in mind there's other options than testosterone, especially if you want to found a family in the future. And please let me know what you think in the comments down below. Thank you for watching.